hot flashes, night sweats, irritability, fatigue. Do any of those sound familiar? Are you experiencing any of them? Those are just some of the symptoms women are having because their hormones are out of whack. Dr. Deborah Wilson is here to talk about how she can help you get all of those symptoms under control. And, you know, I know women are listening to that right now going, yes, I have that. Yes, I have that. Yes,
absolutely.
And boy,
yes.
I tell you, it sneaks up on you pretty quickly. At what point do women really start to experience menopause? At what age?
Well, it's a slow process. So in the 30s and early 40s, your ovaries are still making plenty of estrogen and testosterone and progesterone, but during the late 40s, the production drops. So you can see here, and also pretty quickly, yeah. Sometimes it comes on all of a sudden. So you see here with this chart, also testosterone levels drop in men. So testosterone levels drop in both, estrogen levels drop, and so this creates hot flushes, night sweats, mood swings, insomnia, emotional instability, vaginal dryness, and all of that. So so you're in full-blown menopause, and we're talking about, I know you mentioned testosterone, but there's a whole bunch of other hormones involved as well. Right.
When a woman comes, or a man, I guess, right? Do you treat men as well?
Yes, we do. In our office, we treat men with testosterone, not estrogen.
Right.
But
right. Let's be clear on that one.
Let's be clear.
Let's talk about how you treat these symptoms, and let's talk about women in particular.
Okay.
How do you determine what is the best way to treat these?
Well, not everyone is a candidate for hormones.
Okay.
You know, if a patient has a history of cancer or a history of clotting abnormality, they may not be a candidate for hormones. But if a woman comes to me with these symptoms, I have to determine, I always say, what do you want to achieve? What's important to you? Because some women are just interested in stopping the hot flushes and night sweats. That's easy to do with patches and gels and all that. But if a woman is truly interested in stopping the hot flushes and night sweats and retaining her libido, sex drive, orgasmic capacity, that sort of thing, oftentimes we have to go to estrogen and testosterone. And the easiest way to administer that is pellets.
Okay, and a lot of people don't really understand pellets, and we have about a minute left, but I want to show, this is the size of a pellet, and it's sitting right there. Is that a dime? It's a teeny tiny pellet. And where do the pellets go, Dr. Wilson?
We insert the pellets under the skin of the hip. So we use a local anesthetic and insert the pellet, and then you just end up with a tiny little nick in the skin.
Is each pellet specific to that individual?
Yes, yes. We will decide. I talk to the patient. We try kind of a standard dose, and then the patient comes back in 3 months and has levels drawn. I see how they feel, and I can adjust the dose from there.
And you do the same thing for men as well? Men get pellets?
They get testosterone pellets. You know, testosterone is important. Until recently, we didn't realize how important it was for women. But it is very important for mood and sex drive and muscle building. You know, if you give birds testosterone, they sing more.
No.
Yes.
You heard it first right here on Sonoran Living. So if you'd like to sing like a bird, Dr. Wilson, you're adorable. She has a very special offer for you. You mentioned Sonoran Living, and she's going to give you $50 off your first pellet insertion. There you go. Dr. Deborah Wilson and Associates is located at 10250 North 92nd Street, Suite 102 in Scottsdale. Here's where you can make that appointment, 480-860-4791. Learn more at drwilsongyn.com.